Hi, everyone. Um, we're going to get started momentarily. Today, we're going to be talking about questions around getting tested with your sexual partners and how to navigate that space. Hey, Corey, how are you?
I'm good. How are you?
I'm good. Happy Friday.
Yes, happy Friday. Spring break is next week.
Oh, yes, it is.
Mm, okay.
And
So,
we'll walk around here in a second, and then we'll get started. Do you have any plans for the weekend?
um, nothing specifically. I know it's supposed to be really warm this weekend though, like in the like the high 70s on Saturday and Sunday. It's not so I don't know if it's going to be really sunny, but it's going to be warm, so I'm happy about that.
I know, and we're finally in the land of the sun being out past 6 p.m., so we've made it to the first of the.
Right, 'cause they had on all the way to like 6:30 or so.
Yeah.
Yeah, so that's great.
Very exciting.
Are you ready?
Almost. We're just waiting for our Whitman-Walker partners to join, and then we'll get started.
Yep, yep.
Uh, Folks who are joining now, please check out the pinned comment. You can see information about how to get tested with Whitman-Walker. You can call 202-797-4439, and then we'll be able to help you schedule a HIV or STI testing appointment at either the Northwest DC location or the Southeast DC location.
Alrighty. Okay, Whitman-Walker is here. Ready, Jewel?
Well, how
Hello.
Hello, Paul.
Hello.
uh,
Alrighty.
cool.
Okay. During the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV/STI sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. I'm Corey Haskett. My pronouns are he, him, his.
My name's Jewel Addy, and my pronouns are she, her, hers.
Today we'll be discussing how conversations about getting tested with your partner, with your sexual partners. We'll be going over some tips on how to bring up the conversation and a script for navigating it as well. Navigating it as well, providing testing resources. Getting tested and practicing safer sex can lead to a more enjoyable and memorable sex. Okay. So sharing some experiences about testing with my partner. Um, so basically, like just bringing it to the light. Like I don't think it's something that you should really sugarcoat. I really think it's just something that needs to be done. Like especially in the first beginning stages of your relationship. Like go get tested together. Like I think for I think it's better for you both to know each other's status for it to be up in the air. I know that it sometimes seems like a taboo topic, but it really isn't. It's something that we need to know, um, especially before even considering, because raw or unprotected sex is at a more high risk. So just knowing your partner's status will be better for both of you. And just like just bringing it up with your partner, just hey, again, it's not something that you should sugarcoat. It's very much hey, babe, or whatever you choose to call them. I think we should get tested. I think it's important, and telling them the reasons. I think it's important that I know your status and you know my status all around, just because it makes it more enjoyable. It's it's something like for me bringing that up, it makes me feel better. It makes me feel more responsible, um, just to know my partner's status and he knows mine. Um, it makes me feel a better. Makes me feel better about what's going on as well. I think when you're actually comfortable about someone's status, you are in a better place mentally for the encounter, rather than thinking about it while it's going on or thinking about it after it happens.
Yeah, those can definitely be some stressful thoughts afterward, and
Yeah,
I think it's hard to be in that kind of post meetup space and wondering, you know, should I have reached out to this person sooner about getting tested, and like how do I go about retroactively saying like, hey, I know that we already had a relationship, but like how like what are your testing practices afterwards? So thanks for sharing that, Corey. I think for me, you know, after I started working at Whitman-Walker Health and like learned more about sexual health and getting tested and resources, I definitely embraced the practice of always asking my partners or potential partners about their testing history and like if they've been recently tested and just about their sexual health practices, like if they were people who, you know, always use condoms and barriers when they engage with people in sexual practices, or if they rarely did that, and from there could kind of you know, make the best next step decisions like, should we go get tested together, or can I refer you to go get tested? Because here's, you know, my paperwork or my results from my last test if they didn't have one. Um, so I would also say that I've never had an experience where I brought that up to a partner or potential partner and they were like, oh, I feel so offended. I'm definitely leaving right now. Or I'm never going to see you again. I feel offended. So I can't believe you asked me this question.
Hmm.
I think people sometimes are in fear that that might happen. But I think that that's a good person to like put a red flag on and just be happy that they walked out of your life, actually.
Right.
um, so yeah, I think it's definitely a good thing to ask people. I think it almost invites a more safe environment to be in with you and your sexual partners, and creates a bit of vulnerability for both of you to explore, you know, what your testing history has been, and just introduces the new practice to people. I think often when I've been the person to ask a partner, you know, about getting tested, they've always been caught off guard and said like, wow, like no one's ever asked me that before, which is I wouldn't say a red flag, but like I think we're all learning how we can be more proactive in asking our partners about getting tested and their testing history. So I'm happy to be the person that introduces that practice to them, and hope that they kind of leave our relationship in space, taking that practice with them moving forward. Um, but Corey, I'm interested to hear, you know, what you've learned and how people have reacted to you asking them about getting tested.
Um, Honestly, like you said, I have had encounters where there has had to be kind of a red flag situation. Like just simple, like asking them and like, okay, you know, like, should we get tested together? When a person gets offended or a person is upset about you asking them about getting tested, and that's a definite red flag. That's one of the things that I have learned about asking for test results. When a person gets offended, that's a total red flag. It's like, you know, it's like they're hiding something. Um, I think that when a person's more comfortable with it, it's either because of they're comfortable with their status, or they're comfortable in a sense because of they would rather them know your status as well. Um, and they're just they're in the same level mindset where it's like, okay, I think that this is important, because of that's what I look for in a partner. If I ever bring up let's get us getting tested together, I'm looking for the same response that I'm going to give them. I'm looking for the same exact, like, okay, yeah, I'm comfortable with that. I actually what was going to act like, or you know, them saying, oh, I was going to ask you the same thing.
Yeah,
That all are on the same playing field. It's like they are, you know, they're at the same space where they're like, okay, yeah, I want to do this as well. Um, so definitely, like you said, red flags has definitely been something that I have learned. Um, when it comes to asking about test results, because if a person is, you know, if they get to that place where they're acting, if they're offended, because I honestly just I personally feel that that shouldn't be an offensive topic.
yeah, agreed. Um, you know, someone in the comments wrote, you know, they're out there and nowadays people just want to have sex. They don't ask the sexual status questions or testing questions. And I think that that's probably true for like the history of sex, right? Like I feel like we're probably just getting to more of a space where people are being invited to have these conversations before engaging in sexual relationships. Uh,
Hmm.
the HIV epidemic, people were, you know, in more of a space to have to, you know, be aware of people's sexual health testing statuses and practices and whatnot. And so that's a different generation than us today who are navigating more sexual relationships in our 20s and 30s and teenage years and whatnot. So we might not have been around to kind of know how scary that experience was during the height of the HIV and AIDS epidemic, but we can't forget kind of what our elders have gone through before us. And so, in learning to be more open about your status and just getting tested and practicing getting tested, it's just so important to also introduce those conversations into your relationships. I think what I've learned from asking people if they'd gotten tested recently or if they get tested often or how often they're getting tested is that the majority of them were getting tested one or getting tested that often. I think a lot of them were more religiously using condoms or barriers, but still weren't using it 100% of the time. So they needed to get tested more often and more regularly. But I think I also learned that they were never offended. Like no one ever, was mad at me for asking, caught off guard at me for asking, but not mad at me for asking. And, I got to introduce them to a new resource for getting tested. I usually sent them to Whitman-Walker Health. Just because I knew the testing practices and how easy it was. An HIV test takes 1 minute. STI testing is a few swabs that you conduct yourself. So it's just a super easy process. Again, if you want to get tested or schedule an appointment, visit the pinned comment. There's a phone number. It's 202-797-4439, and you can access a testing appointment here in the DC area. But again, people were super open to it. You get to introduce them to like the practice and habit of getting tested more often and bringing up this conversation with their partners by just having it with you. And it also would lead to conversations around like, okay, so cool. Now that we've talked about getting tested, like, what are things that you're okay and against in the bedroom, and that kind of also opened up the space for a healthier relationship to be developed. So yeah, it's been really good.
Yeah.
And would recommend it. Uh, so I think we'd love to give you all a few tips and tricks on kind of conversation starting points that helped us talk to our partners about getting tested. But I'll hand it over to Corey to kick us off.
So when was the last time you got tested? I'm interested in our relationship becoming more physical. But before we move into that direction, I'd like to share our testing results. How often do you get tested for STIs?
And then a few other ones are, what are your safer sex practices? Might include ... and you can insert what you do, whether that's like wearing condoms and barriers or using condoms and barriers, or if you are, using contraception, like birth control. If you're someone who gets tested every couple months or so. But yeah, those kinds of questions or those kinds of sharings on your end. We also ask or suggest asking, how do you keep yourself safe in sexual relations? Or do you ever ask your sex partners about getting tested or to see their testing results and just get a sense of what their response is? And you can kind of go from there into your conversation about testing. So thank you all for joining us today. Again, if you need to access testing or HIV or STI testing, you can call 202-797-4439 to schedule an appointment with Whitman-Walker Health. If you're in the DC area, you can visit dcbeings.org for information on getting tested and sites here in the DC area. Before we go, we want to give you a few reminders about the COVID-19 current status of the pandemic and vaccines. The CDC recently relaxed mask guidance, saying that you mostly don't need to wear a mask anywhere unless you're indoors or in crowded spaces. So you gave her literal breaths of fresh air from these mask mandates. If you've already gotten your vaccine, congratulations. You've taken a really important step to preventing yourself, your loved ones, and your communities from illness. As more variants have continued to soar and pop up on us, it's been super important to be vaccinated, since the vaccine isn't 100% effective at preventing new COVID-19 infections, but it does help prevent hospitalization and death and people from getting very sick from COVID-19. So all in all, stay alert, wear your mask if you're in crowded spaces, and continue to ask people, if they've been vaccinated, so you can know how to proceed accordingly. But if you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has a COVID-19 vaccine available. everyone ages 12 and up is eligible to get a Pfizer COVID-19 vaccine, and everyone 16 and up can get a COVID-19 vaccine, period. But please reach out to us at 202-207-2480 to make a COVID-19 vaccine appointment.
For DC residents, you can find information on COVID-19 vaccine walk-up locations and eligibility at vaccine.dc.gov or by calling 1-855-363-033. Track the spread of COVID-19 vaccination lines by visiting corona.virus.dc/don't wait. For Maryland residents, you can learn more about the Maryland vaccine distribution process and schedule a vaccine appointment at COVID link.maryland.gov or by calling 855-635-6829. If you live in Prince George's County, visit the vaccination registration portal here. If you live in Montgomery County, visit the vaccination registration portal here or call 240-777-0311 to schedule an appointment. For Virginia residents, learn more about the Virginia vaccine distribution process and schedule a vaccination appointment or vaccine at vaccine.virginia.gov or by calling 877-829-4682. If you haven't been vaccinated and you're looking for an appointment, I'm sorry. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC's guidelines for mask wearing, quarantining, social distancing, and the like. It is very important that you consider getting vaccinated. Discuss COVID precautionary measures with those around you. Be mindful of masks and keep your distance. But especially when you do not or you're not aware of a person's vaccination status. Remember to follow us on IG, Facebook, and Twitter at Whitman-Walker and checking the website at whitman-walker.org for the most up-to-date information on our services. For more COVID-19 resources and general Whitman-Walker services, please call us at 202-797-4439 for some of our programs and Whitman-Walker Health Family at Real Talk DC and No Filter DC. Thank you for tuning in, everybody.
Yes. And make sure you talk to your partners about getting tested moving forward. We'd love
Exactly. Knowing their status and knowing your status is very, very important.
Yeah. All right. Happy Friday, y'all. Bye.
Bye.